I have all these illnesses, and there's no cure for them. An incurable disease, medical errors, and the fight for euthanasia in Brazil. I joke about things like this, even my own death. And humor itself, it's my way of dealing with difficulties like this. I already know the songs I want played at my cremation. One is Chop Suey by System of a Down because it starts with Wake Up. If I don't get up with that guy screaming in my ear, I must be dead. Bruna, my mugs always made you laugh. Now you have your own. Kisses. Preta, this meant a lot, even before I knew you personally.
How did you take her death? What did you feel?
Did Preta really die? It's always hard when one of us leaves, so that's how it is. I'm only like this in the hospital during admission because it's very stressful. They've even prescribed me the wrong chemotherapy at triple the dose.
So there are a lot of medical errors, mistakes.
But a lot.
What are you trying to say to people right now?
The doctor can't be the only one who holds knowledge. I think patients have the right to knowledge, and I think medicine doesn't make that access easy.
Just to be clear, your fight is for the right to medical information.
Medical knowledge is knowledge about our bodies. It's getting harder and harder. The challenges are growing. There will come a time when I'll say this pain is enough, then I'll give up and I'd rather die.
That's why you left a living will.
This body, it deserves dignity even after death. I make the decision to take my medication on time. I make the decision to exercise.
Because you want to live?
Because I want to live. I don't ask why it happened to me because that makes me sad. But if it happened to someone else, would that be better?
But that shows a great spiritual evolution. It's a lesson. I'm learning here with you. I'm learning to be more humble.
I kept asking myself why you invited me.
The episode is starting. It's amazing. But first I have an important message. We noticed that 81% of the people who watch Tres Atos are not subscribed to the channel. It's a simple, free gesture for you, just pressing a button, but for me it means a lot and makes all the difference. So here's my request. Subscribe to the channel and share this episode with someone you think will like it. Hold on, the episode is about to start. But I have just one more message for you. If you want to study with me, take all my courses, and even have a live mentorship every month. On Zoom, come join the Jornada Club. All the details are here in the video description. Check it out. Now let's go to the first act. My guest is a speech therapist who saw not only her voice, but her whole life change its tone. She was only 27 years old when fate imposed itself in an inexorable way. A severe genetic syndrome would force her to live between doctors' offices and hospital wards, exam rooms and surgeries. And always, with the non-negotiable possibility that something could shorten her life, the same procedures that ensured her survival reduced her autonomy. She started wearing a mask and limiting physical contact even with her parents. But my guest is as resilient as the rocks of Arpador. 8 years have passed, a lot has happened, and she is still like a little bird searching for the next flower. With a contagious smile and an impressive energy, my guest became an activist against ableism, joining groups that fight for quality of life and palliative care for everyone. On this journey, she made many beloved friends like Pretagiu, with whom she shared religious faith and the desire to live life as happily as possible. Given everything she has experienced, my guest began to advocate for the right to assisted death and has already written a living will stating that she does not want to be kept alive. On the day fate decides it's time to go, Bruna Martinovic may enter. I'm a pink. All right.
I have a hard time parallel parking. It's really just a matter of my own skill.
Never had any.
And on my way here, a van hit and even closed my car's mirror, but it didn't break. It's okay.
So you kept driving, you didn't stop?
No, I stopped driving and then started again. I went a few months without driving, but I don't like driving. My dad is the kind of person who likes to hit the road, but I don't like it. But it gives me a lot of independence. I can do my own things. So for me, it's important to be able to go to the doctor by myself, to be able to do things on my own.
You do everything, right? Uh-huh. Your mom was telling us that you're a very fun person. She said she has a nickname for you, which is Buobro.
Oh, I think she calls me Boo.
Boo, because of a cartoon.
It's from Monsters, Inc., which had Boo, who was a little girl, so it's common for her to call me Boo.
Because she thinks you're a little monster.
Oh, but she was a little girl, not even a little monster.
It's not because you made a mess.
No, I think it's more because it sounds like Boo Boo. I think it's more because of the similar sound.
And your brother calls you Jum?
Jumenta?
Why?
When I do something silly, like if he was parking right now, hey, Jumenta, he just says it like that.
And what do you call him?
Sometimes I call him Jume Nelson because he calls me Jume, and Nelson is just a male name.
But he's also Jumento.
We tease each other for fun because what goes around comes around. We joke a lot at home, including with my dad.
But you've always made jokes about everything.
Haven't you? I think I got worse over time like that.
But after the illness, yeah.
I think that's when I became more good-humored.
That's really how it is.
Yeah,
I think I would have gotten grumpier.
obviously. Sometimes I do get grumpy, right? But usually I say something, I joke like, I'm in a bad mood today, so don't even try because I'm irritated. Or, that's therapy, right? I say things out loud, and humor itself is a way I deal with difficulties. That's what my therapist always says. That's how I found a way to really deal with things, Because it's a lot. That's just how it is, right? It's always doctor's appointments.
By the way, I was going to ask, did I say anything that doesn't match your reality?
I thought it was very beautiful, including what you wrote.
Oh, that's good.
But that's exactly it. It's a life that's very affected by the medical environment and everything, and long hospitalizations, right? If we hadn't played before, consider this. My mom and I spent 50 days in a hospital.
But do you even joke with the doctor?
Oh, I make up a story sometimes. So one time I went like this, when I went to have my intestine removed. So the doctors, the surgeons, they have a team, right? And the doctor who was going to do my admission at the hospital, I didn't know him. He was very polite and nice. The doctor asked, "May I examine you?" I agreed. But I had a this gastrostomy, which was a feeding tube that stayed in my stomach. When I removed the gastrostomy, it looked like a belly button. So I say I have one belly button and two bigos, since I ended up with two in the same spot. He looked and said, "Wow, we can remove this adhesion during surgery." And I thought, oh no, then I'll just have one belly button. He didn't know what to do because he wasn't expecting it, right? So I like to do things like that when it's unexpected. And today I made a joke that was funny. I was recording for the Anatomy Forum, where we talk about palliative care and all that. And we were recording.
Later, let's also discuss the Anami Institute and Anami, which I knew.
We started recording, and then Tom, who was a close friend of Anami, joined us. Almeida mentioned that once he sent some soup to Ju, who was the other journalist and all. And then I said that because she was sick. And then a little later, in the end, I said, "Tom, I'm always sick. You can send the soup whenever you want." So it was kind of awkward. Doesn't he know that I do that? And then he laughed a lot. But I joke a lot about the fact that I'm always sick, that I'm always in the hospital. I think it was lighter that way, but that's a fact. People who know me already expect these jokes to happen, but always with me, right?
Usually you're the subject of your own joke.
Oh, yes.
But you know that great comedians make a lot of jokes about themselves. So do you have a knack for stand-up comedy, something like that?
I considered doing a stand-up routine as a patient. Wouldn't it be great to perform it in the hospital? Get on stage?
No, but you're here instead of at the theater. You said you make jokes even about yourself, that's right, and about your own possibility of dying.
Yes, I joke about my own death. One day I realized my mom wants to be cremated since she's never been to a cremation. She says they play music at them, right? And then I said, wow, I already know the songs I want at my cremation. One of them is that Chop Suey by System of a Down. Because it starts with Wake Up, tarararara. I said, that's a good one, but why is the other one good?
To see if you wake up?
It's like if I don't get up even with the guy yelling in my ear, it's because I'm really going to die. And the other one is, should I stay or should I go?
What did your mom say? Are you bringing up my mom?
Oh, she made a comment like, don't feel sorry or something like that, but she laughed. My parents laugh. They're already used to it.
There's a joke every day.
Oh, yes, and like things they don't expect. I mess with both of them a lot. We swear a lot at home, really, a lot.
I heard that you have a certain fondness for swearing. Is that true? How is that? Do you make up new swear words?
No, I like it because she says swearing relieves stress. I swear a lot in life, you know.
Like,
Like, fuck it, I say it. My favorite is fuck it. I embroidered a picture. It's on my wall. Fuck it with a little flower next to it.
what's the other one you like to say?
Shit, fuck it. I think those are my favorites, right? It's not like some crap you hear on a soap opera at 7. That's too little. It has to be something better. And then I swear a lot. My parents started swearing because of me, because I swear so much.
So you're teaching your parents?
But I say, see, it didn't help.
So what's the other one? The one that comes out a lot?
It's sometimes when playing around, it's sometimes... My mom teased me this week and I went, go screw yourself. And then someone might say, oh my God, she told her mom to go screw herself. But that's how it is. We swear a lot and tease each other a lot for fun. Like...
That's a way to ease your pain.
Yeah, I think so, yeah. It kind of transforms like that. There were times when I saw my dad cry, and when I started crying, my mom and dad cried too. Yeah, that's really striking, so much so that I remember it like that. Yeah, it's not like that all the time, right? That's something I always talk about on Instagram, that people might think I'm always calm, that I'm always relaxed, and that I'm always happy. That's not true. It's just a snapshot, I say. Sometimes I feel like I'm screwed. This is the end, since I've felt that way before.
I've already said I'm screwed.
Right here. I was in the intensive care unit and I said, oh, now it's over. This is it. I'm done. That's it. I went through that really thinking that it was the end, and also in a moment of acceptance saying, look, if I go now, I'm okay. Everything's fine. Yeah, you can take me. It's all right. So, yeah, that's how it was. I'm not like this all the time. I get really pissed off about things. I'm in the hospital, right? Being hospitalized is really stressful, so a lot of things happen, like procedures go wrong or the wrong medication gets given in the room. I'm really allergic. Yeah, they've already prescribed me the wrong chemotherapy with triple the dose.
There are many medical errors.
Mistakes, a lot of them.
What are your examples? Just bring the microphone a little closer. What are your examples of medical errors?
The triple prescription. My doctor mentioned something like that. When you're in the hospital, there are hospitals where when the doctor is from outside, the in-house doctor has to write your prescription. Outside doctor prescriptions aren't accepted. I was in a hospital in Campinas and my doctor correctly prescribed the IV fluids. How long should the dose last? Everything was perfect. And then the doctor, when it was time to copy, he just had to copy. He prescribed it for 3 days in a row.
Instead of one?
Instead of one. When the second day came, because I was under observation since it was a heavy treatment and all, when the second day came, the second bag arrived. Then I said, no, that's not mine. Oh, but it's prescribed, you have to take it. Then I laughed. I said, no, I don't have to take it just because it's prescribed. I'm not going to take it. I said I'd talk to the doctor. You can talk to anyone and bring them here. I told her I won't take it, even though the medication was sent. I said there will be leftovers because I'm not taking it. Sometimes that's just how I have to be. I joke a lot. I always try to be very polite because I work in healthcare, so I know it's not easy. So I work at a public health unit and everything. I know it's not easy, so I always try to be as polite as I can with everyone who helps me. But sometimes when you need to be firm and it's not just about medical mistakes, During my last hospitalization, I began parenteral nutrition, which delivers nutrients directly into the vein. And then you stay connected to the infusion pump. You can't leave. If you need to take a shower, you'll take a shower while connected to the pump. And the nutrition doctor didn't talk to me about increasing the dose. He doubled the dose. With that, I would be stuck to the pump for a long time when it arrived, and I wasn't even informed. When the second NPT bag arrived, then the nurse, oh, it was the second bag, then she would go there. The doctor prescribed it, then I said I won't take it. Then he was like, oh, you won't take it? And I said, no, I won't take it. But the doctor prescribed it, I understand. But I won't. He didn't talk to me before prescribing it. I'm going to miss a physical therapy session. Physical therapy is just as important as nutrition, and I was eating orally. But the NPT wasn't just the NPT. And then I explained myself. Then the intensivist, right away, got mad at me, thought it was absurd that I did something they had contraindicated. But for me, it's very simple. If it's mine, if it's about me, I have to be consulted.
So the doctors should fear you, or at least not hate you.
I think many of them hate me and others like me. It's either they hate me or they like me. He finds it funny and knows that's how I am, which is why he says it. I'm alive because those 3 bags of cyclophosphamide would have killed me.
He said you'd be dead from that one chemotherapy.
He said you wouldn't have survived 3 days on that cyclophosphamide dose. You would have died.
You sued someone.
They have a way out, so you'll end up spending a fortune on a lawyer, and they always have a way out. The doctor's lawyer is always better. The doctor's not the hospital's always, so that's how it is. I've never sued anyone. My illness started with a mistake, not by a doctor but a dentist. Why? I just had a wisdom tooth out. And then there's something that's dangerous. When we have a tooth removed, a blood clot forms there to protect what's underneath while it heals, but I lost that clot. It's called alveolitis, which exposed the bone and a branch of the trigeminal nerve. I was in a lot of pain and would return to the dentist, who said the surgery was extensive and that I was very sensitive and weak.
He said, you're weak and cute, a dentist.
I spent 10 days going to him. It's hurting, not yet. You're sensitive, forget about it. I would say like this, the pain stops here because it radiated and stopped in the middle of my chin. The pain is there. He didn't until it got to a point where it got infected, and then he did. Suddenly he said, wow, that's a really wet alveolitis. Then the anesthesia fails, so you have to proceed without it. He opened it up and did everything, and then like that. For me, it was kind of like a horror movie because there was a lot of blood, so he opened it up and cleaned what needed to be cleaned, took everything out. Then he gave the wrong antibiotic, which doesn't work on bacteria that live in the mouth.
A dentist?
And then when I got to the infectious disease specialist, who is still my doctor to this day, he looked at me and did this. We're going to try the medication for a week, but I don't think it will work. You'll probably need surgery. Because the infection had already spread to my mouth like this, so everything here was infected, but the lining of my mouth was still there, and in fact, just the medication wasn't enough. It was a major surgery because they had to, clean the lining, clean everything here, and I didn't even sue that dentist.
But your syndrome is genetic. How was it caused by the dentist?
It's not caused, it was a trigger for lupus. Due to an infection? It might have been any infection, even COVID.
But you might never have had this disease.
I might never have developed lupus, yes.
It was because of the dentist.
It was the infection, it was the trigger, so it could have been another infection, I might never have developed it, that's possible too. And then lupus started, I began taking a lot of medication, but it took a long time until your lupus diagnosis. I felt bad, tired, my skin was red, but it wasn't enough to make a diagnosis. The rheumatological diagnosis is complex, right? One thing led to another, and I reached this point. I had strange things. I've always been very allergic. I've had some anaphylactic reactions in my life. That was already kind of weird. I have hypermobility, like this is an example. But there are others, joint hypermobility, like that ends up causing injuries, right? And this hypermobility is what causes injuries in my spine, for example. So some things have nothing to do with the dentist, but the way this happened does. It was like dominoes, not the game, but how one piece knocks over another. My digestive system kept getting worse, you know. I had to have my large intestine removed, so I never really got a break.
So that tragic appointment was when you were 27 years old, and that's when your pain started.
I was never healthy again and always had headaches. I have a constant daily headache. This headache never went away.
What is this constant daily pain like?
I joke like this, you feel your knee.
Just because you mentioned it now, I thought about it.
I feel like I have a head all the time. It's a pressure that starts at the base of the skull, and if it worsens, spreads to the eye. Sometimes the pain intensifies. It's at the base of my skull now, so I always feel like I have a head.
Are you in pain now? Where? Show me.
It's deep inside here, like this. There's a small hole, so I feel it far inside.
Strong.
It depends on the day. Right now, it's not strong.
But it hurts.
It hurts, yeah.
She never stops.
I can take anything I want. It stays.
What explains this pain?
Is it? There's something that became very complicated for me, which was the chronic use of corticosteroids because of lupus. That worsens my other conditions. So, for example, with the syndrome I have, which is called Ehlers-Danlos, I shouldn't be taking corticosteroids because corticosteroids weaken the bones. Corticosteroids and other factors cause my diabetes. And it got worse. Yeah, this issue is with my cervical spine. So when I went to have my first surgery, I already had bone wear on my vertebrae. So that's how it is. I have one. This hypermobility is like what holds the spine isn't a strong enough structure, right? And to make things worse, the corticosteroid gave me osteoporosis. So now I have to treat the osteoporosis because of the corticosteroid. So that's why it is. It's not exactly a causal effect, but all this synergy obviously harmed me, right? I've been taking corticosteroids for 8 years.
I still couldn't understand. Thankfully, no. What issues you have, what the disease is, which one led to the other, where it all started, and what ended up developing.
I have a hereditary genetic syndrome called Ehlers-Danlos syndrome. The main characteristic of Ehlers-Danlos is hypermobility, this thing where the joints are hypermobile.
You said they call you Elastic Woman.
At school, I used to pop my shoulder out for fun. If I press here, my shoulder pops out. I can't lift my arm to my ear because my shoulder pops out too. I've also dislocated my femur head during a Pilates class.
And it went back into place again.
Do I put it back myself? I've never been to the hospital. You get used to doing the reduction, like, oh, it popped out again. Then there's a way you do the reduction, it fits back in, and that's it. I got used to it.
But this was already linked to the syndrome.
The main characteristic of this syndrome is hypermobility. We also have a certain elasticity, even in the skin, because it's collagen. Our collagen has a different structure, but the whole body has collagen. That's the problem. The whole body is made of, has collagen, so the bones, the ligaments, the skin, so regarding the ligaments. That's why we have disease.
I can't do what you're doing with your hand, right? My finger doesn't reach here. No, yours touches.
It touches completely.
Oh, wow. In theory, this could be good for a ballerina, maybe.
No, because there's an ease of movement. So for me, it's easier to stretch. It's just that the joints don't stay properly in place. So imagine a ballerina with her femur head popping out when she does a split. That's not good, right? Obviously, there are people with Ehlers-Danlos who manage to get stronger. And then, right? They have good flexibility in ballet, like being a contortionist. But I don't see it as an advantage because you'll have to do a lot of strength training here to hold the shoulder in place.
What's the name of the syndrome?
Ehlers-Danlos syndrome. Ehlers-Danlos is spelled Ehlers-Danlos.
It's the name of someone who probably discovered it.
I think it was Finland.
So your medical history starts with Ehlers-Danlos syndrome.
It was diagnosed last.
What was the first one?
Lupus?
After the dentist?
Still, it took a long time before the diagnosis was confirmed. When I had central nervous system vasculitis, there was vascular inflammation, right? In the brain, it's very serious. It can even turn into a clot. Anyway, it's very serious. And that's why I had to take cyclophosphamide, which is a chemotherapy drug, and then it was 6 months of treatment, and then my leg burst.
You wore a mask before the pandemic.
Already because of the cyclophosphamide, so I have pictures of myself in restaurants with a mask on, waiting for my food to arrive at the table, like...
During the pandemic, you hid yourself, so yeah.
It was something like that. My rheumatologist, I insisted a lot on continuing to work. I would do chemo, spend 2 days in the hospital, and on Monday I was back at work, in person, with children in a pediatric unit, and kids, well, obviously, right? They're just starting out, their immune systems are developing, so they get sick often. So I kept catching things all the time and everything, but I stood my ground. I'm going to work. When the pandemic broke out, my rheumatologist introduced me to the PFF, to mask before anyone else. He said, go to this website and buy this now. You're not leaving the house anymore, that's it. He was firm. No more negotiation. I started using it and stayed home for a long time. My mom would even go to the front desk downstairs. And at that time, my mom came to live with me in Campinas, and my dad stayed with my brother in São Paulo really to isolate me, so I stayed. My dad wouldn't come in when he visited us. He stayed in the hallway and just said hi from a distance.
But even now, you still sort of avoid it.
Right? Yeah, we all wear masks. But last year, there was one time when we went to a restaurant together.
You and your father.
Me, my father, and my mother. Then I realized it had been 4 years since I ate at the table with my father. So it caused this immunity thing, which the doctors don't really explain well. It could have been because of the lupus medications or because Ehlers-Danlos also has an issue with immunity, right? These recurring allergies of mine are because of another disease that falls under the Ehlers-Danlos umbrella.
So what is it that you have? What are the...
So I have Ehlers-Danlos syndrome, and along with it, I have digestive system paresis. I developed colonic inertia, meaning my colon stopped working and had to be removed. I have what's called mast cell activation syndrome. It's kind of like an allergy, but not exactly, because mast cells are cells that get activated during allergic reactions. Mine activates randomly, which is why it's called activation syndrome. I joke that my immune system is like those inflatable tube men at gas stations. Nobody knows what they're doing. Nobody knows where they're going. A doctor said, girl, that's just how the immune system is. So I have this mast cell activation, and I also have immunodeficiency as a variable, because my B lymphocyte count is very low. It's the one that produces antibodies. So my antibodies, because we can measure the total antibodies. We talk about immunoglobulin A, immunoglobulin G, and immunoglobulin M, and mine are very low. I have immune factors that let me be here with you without a mask.
I wanted to ask if it's risky for us to be here.
I have a doctor who, when the pandemic started to ease up, said, we choose the risks we want to take. And that's how I live today. For me, being here and attending the Anami Forum event I just recorded was important. So I'm going to stay here without a mask, and I'm going to do this work without a mask because it's something important to me. Having lunch that day with my dad and my mom was also important. So I expose myself to certain risks, like what could happen. I could catch something and it could get complicated with infections. That could happen, right? And the biggest risk is dealing with myself. For example, if I'm at a theater, it's very risky because there are a lot of people and there could be someone there who doesn't get vaccinated. My parents get vaccinated for me because although I produce antibodies when vaccinated, they become a barrier since they're around me the most. So if I'm in the same house as them, everyone there is up to date with their vaccines, right? When I started like this, they went to check their vaccination cards and were like, oops, measles, we're missing that one.
Unvaccinated people put your life at risk. That's a fact.
Fact, fact, fact. It's really for everything. It's not just COVID, it's anything that can, right? Respiratory illnesses, those kinds of things, right? Measles, rubella, chickenpox, all these diseases that have vaccines, mumps, which are transmissible. Sometimes something lingers in a droplet, right? We touch and catch it or through the air, but yes, anyone who doesn't get vaccinated is a risk to me. It's like a newborn baby who hasn't had vaccines yet. They have very little immunity, just like that.
You, every day, are like a newborn baby. Yeah.
It's because my antibody production is very, very low. There's something there, but it's inefficient, right? My infectious disease doctor says, take the vaccine, whatever comes is crazy.
The vaccine is not a danger to you.
I can't take live virus vaccines or attenuated virus vaccines. Yellow fever, I can't take dengue. I'm not sure, but there are these attenuated virus vaccines, right? Because since I don't have immunity, the disease could develop. So it has to be, for example, I can take all the COVID vaccines, right? So mRNA, messenger, anyway, there are other ways of, yeah.
I interrupted. Did you finish what you wanted to say?
No, I don't think so. So it's Ehlers-Danlos, right? With mast cell activation and digestive issues. And Ehlers-Danlos caused my spine problem, correct? I needed 2 major surgeries due to spinal cord compression. And lupus, along with lupus, a disease called Sjogren's syndrome.
Which is?
It's an autoimmune disease that affects the salivary gland, the ophthalmological part, right? It likes glands, it attacks the glands, so I have little tear production, I have little saliva, that kind of thing.
Today you have very limited social interaction, so with people. Your work as a speech therapist is done by video conference. You don't go to a place, to a hospital.
The risk, besides the immunological issue, working with children has become unfeasible for me because of my body. I say it's not safe for them at the moment when I can't, right? There was a child once who went toward the window, right? Why? It was a child with a degree of autism. Well, anyway, a child who needed a high level of support, and he was about 6 years old. I wasn't alone in the room. I was with the occupational therapist. Unfortunately, it was a unit that was absurd, right? But there was no screen on the window. And we held him by his shirt. Because he was a very restless child, right? So, you know, kids can really get hurt, right? Sometimes we have to restrain them, right? And so I've always dealt with children, sometimes with neurological issues, so they need someone there, right? I think restrain is the word, right? With care, obviously, but I have to, right? So they don't get hurt. One time I got hit with a chair by an 8-year-old boy, so yeah, that's what I mean, guys. I grabbed a chair, but he went around and hit me on the back with another.
You couldn't take a chair today, right?
But, like, not just because of me. He could have done something to hurt himself, right? Sometimes, while you pick up a pencil, a child has already climbed onto a chair to hang himself. I don't know, it's just how kids are, right? And that's okay, kids are like that. So I loved working with kids. But there came a moment when I said, look, for their safety, it can't go on like this anymore. And then I went back to working only with voice like this.
And about the intestine?
The intestine, I have issues. My entire digestive system is very slow, so I can't eat much. I always feel nauseous. Food takes a long time, so I eat more at breakfast. Because as the day goes on, my digestive system has more food, so I feel full. My dinners are always small because I can't eat much. There was a time I used it. Can I mention the medicine's name?
If you want to.
I used to take 5 bisacodyl pills, Dulcolax, Lactopurga, daily, much more than the usual 1 or 2, just to go to the bathroom, but I still couldn't have a bowel movement. And that was it. With Movinlax, which is bisacodyl, it makes the intestines move faster. Movinlax brings water to the intestines, leaves more water to make it easier to have a bowel movement for, well, the stool. Even then, I couldn't use the bathroom. I used, there are rectal liquids, right, that you can find at the pharmacy and all. I used all of that. When I had the magnetic resonance imaging, I saw the large intestine goes up, crosses the abdomen, and descends, while the small intestine ends where the large intestine begins going up. There was a buildup of stool that was at risk of rupturing, so if it ruptured, you could die. It's a serious, widespread infection with a high risk of death. He then had a 10-centimeter dilation. Yeah, then the doctor said, Bruna, there's no other way. Some doctors suggested removing only part, but I said if you do that, you'll just have to remove the rest later.
They removed all of your intestine.
The large intestine, I had it completely removed. So, I asked to have an ileostomy, and the surgeon wanted an ileostomy. As a precaution, since he connected my small intestine to my rectum. But when you only have the ileum, you lose. The large intestine is what absorbs the water, so the stool is very loose. So that's what I was saying. Guys, imagine the desperation, liquid diarrhea, like a colonoscopy prep. I don't want to live like this, running to the bathroom in fear, you know? And the bag is here, I'm calm. If I have diarrhea...
Your entire digestive system now passes through the bag.
This is how I have a bowel movement. It's the bag, so it ends here, but the bag is right here. One day, while out with my mom, I told her I had diarrhea. She wanted to go home, but I insisted we go to the mall since it was nearby. Nothing's going to happen. I'll just empty the bag and that's it. Take some medicine, right, to feel better, and that's it. Now, imagine me out on the street without the bag, having to run to the bathroom because I have diarrhea. Sometimes you don't have a bathroom, right?
So that was the right decision.
It was my decision like that? I heard the most absurd things like that. Because when I went to have the surgery, I already wanted helio. I would turn to the doctors wanting the surgery the way I thought it should be. But then I study a lot, so I would talk, I would say, look, I think because of this, and this article, and that, and something else, removing part of the intestine alone isn't enough. That's why I want a helio. I don't want to risk an emergency bowel movement. She took many medications for diarrhea and had an ileostomy, which is the small bag. I began fighting for her, but a doctor said if you get an ileostomy, your life will be over. I decided not to have surgery with this doctor and to see another. My life is still very good with the ileostomy. Predagil did something wonderful because it showed people that you can live well with the bag. It's not the end of the world. Life isn't over. You can go in the pool, and there are other people who show this too.
You mentioned Preta Gil, who taught many people, and you are also teaching a lot to many others. What is it that you want to say to people right now?
I really want to talk about illness because no one is immune. I never wondered, why me? I'm not special. Illnesses happen. I even studied disease in college. Everyone is susceptible to illness, and the doctor can't be the only one who holds all the knowledge. I, as a speech therapist, can't be the only person who knows. So when I give an exercise to a patient, I say, do you want to know why this exercise? What was my reasoning for giving this exercise? Some people say, oh, it's not necessary. But I want the person to have the right to this, to understand why they're doing it. I think patients have the right to knowledge. And I think medicine doesn't make this access easy. Academia doesn't make this access easy. And sometimes there's this thing of them wanting to, so like I can go on Instagram and talk about vaccines, and there was a time when a doctor turned to me and said, you can't talk about vaccines, you're not a doctor. Even when we speak up, some doctors act like I can't have knowledge and try to dismiss me.
And do you know why they do that? Do you understand?
I think it's arrogance. I think it's that kind of thing. Not every doctor, because someone might come and say, oh, I have my doctors that I love and they saved my life. And anyway, sometimes you become friends with the doctors. I really like them, so it's not all doctors. But I think many are arrogant, including my doctors. I think I like them because they always explained everything to me. I'm going to give you this medicine because of this. Look, the surgery will have to be like this, and this because of that. It's all right. How are we going to do this? Look, I recommend the surgery as it is. This will be the path to the surgery. What makes you more comfortable?
So, just to be clear, your fight is for the right to medical information.
It's about knowledge, because medical knowledge is actually knowledge about our own bodies. It's not just knowledge, it's not a philosophy, right? It's not something external to us. It's here, so I have the right to understand the processes of my own body. So sometimes when I say I didn't learn this in college, oh, the ascending colon, I went. Obviously, we have some idea about the human body, but I went after understanding exactly what that is. So I could understand what surgery I was going to have, what I was going to go through. And besides that, because then people say, but why didn't you do the enema? I know the answer, because it wouldn't reach, because it wasn't a buildup of stool at the end of the intestine, it was at the beginning, and the stool was reaching the small intestine. That can't happen. So I go into surgery with a certain peace of mind that, yes, I have to be here.
You know what to do?
Yeah, I have to be here today, so I don't have the technical knowledge. I have no idea how they do it. The surgical technique is one thing, but what's going to happen to my body, right? So am I going to be left without my intestine? The doctor said I'd get an ileostomy that could be reversed, but I decided to keep it. I can only do this because I have access to knowledge, and not everyone has that access. Or because I studied in the healthcare field. I find it easier to understand certain things because I have, some previous studies, so it's really rewarding to do this. I had a problem with my small intestine even before having my large intestine removed. So I made a video explaining what had happened to me and that it was an intestinal intussusception, which is an invagination, right? The intestine folds into itself. I had several spots of intussusception, and then I made a video explaining what it was with images. Look, this is what happened during the surgery, and here's an image of a person. Someone discovered they had intussusception because they saw my symptoms. They saw the doctor, had the exam, and that was it. And intussusception, without treatment, that section of intestine can die, so it's important to recognize it. And another mother found out that her little child had this too.
What you didn't know, right?
Yeah.
Those were the ones that got to you.
So that's pretty much how it is. Guys, it was just the basics. Having the doctor talk to you is the bare minimum. Sadly, we don't even get that. Not in the public system or private care. It's the minimum.
Of information.
And,
The right to choose your medical treatment. What you know is right or what you want, you have.
it's a struggle. So for me, this thing about the ileostomy, I said like this, I don't want to be in this emergency to evacuate, I don't know what. So in case I wanted a certain procedure, I had to fight for it. To look for a doctor, which is a privilege for those who can afford to pay for a doctor, right? Because in the public health system, we can't change doctors, right? So thinking about something universal, most people still won't have the right or will have to wait a long time, we know. We'll have to wait a long time for that procedure. And even with more complicated health insurance plans, we see a lot of resistance. Being in the healthcare field, we know ignorance is bliss. Sometimes we also have a very complicated supplementary system, right? Oh no, the supplementary system can also be quite complicated.
An example of an adversary here was our crowds.
You know,
I understand. You see, yeah. Which I think matters to you. Here are some photos for you.
it's even scary.
But this was the photo I received, and it seems to me that it's important to you in those friendships you made.
That was very special. That was even before I met Preta in person. She had mugs covered in swear words, which I found funny, so I'd laugh and respond to her.
You guys exchanged swear words.
It's because her mug had something like "fuck it" written on it, and I thought it was really funny, Then one day, out of the blue, she said, "Give me your address, I'm sending you some mugs." And she did.
It was saying, go fuck yourself.
Not those mugs. They were something like, "Don't test my patience," you know?
It was just a bit more grumpy, that's all.
It was more relaxed that way, but then she sent me 2 mugs and a note.
And read it for me.
"Bruna, I know my mugs make you laugh. Now you can laugh with yours. Kisses, Preta."
And did you become friends after that?
That's us. I only saw her in person once when she was already in the hospital. That was when I met her in person. And it's that she is the kind of person who's really exceptional. I mean, I think she's very generous and very caring toward others. Like she was very affectionate. When I posted something saying I wasn't doing well, she would just reply, "I'm here." So that's how she was. We weren't physically present, but we tried to be there, to be present, because why not? We never know what the other person is feeling, but we know it's not easy. And then I think empathy becomes stronger. When we go through that, we say, wow, it's tough, it's not easy. So she was really present for me, even if it was through social media.
And how was it when you two met?
Really? I can't really say it was great because she wasn't well. I was happy to meet her, but it was at the hospital where she was admitted.
We
had the same surgical team, and we were always in the same hospital. We were even hospitalized at the same time once, but this time I wasn't hospitalized. It was in January of this year, I think. It was at the beginning of this year. These mugs were made last year and this year.
Now, you were still hospitalized near Pretagil in the hospital.
We were hospitalized at the same time this year, except I wasn't in January. And she was hospitalized because she was still recovering from that surgery she had last year. It was a major surgery.
And she kept track of her illness, yes, and she followed your progress.
Yes, and then she had that surgery. It was a lot. I remember it was kind of close to Christmas because I know she spent Christmas and New Year's in the hospital, and that's how it was. In January, I wanted to bring an obalwe, which is an oryxa that deals with illness and healing, and then I asked to bring that image himself. I have one that stays on my nightstand, and then I wanted to. And this obalwe that I gave her, I had taken with me to a spiritual center.
What does it represent?
A painting is an oryxa. It's an illustration by an artist named Anna Kunha, and obalwe symbolizes things related to health, illness, and healing. He is an oryxa with this symbolism, and since I already had one, I bought one for her, took it to the center, and wrote her name on it. The oryxa I gave her had her name on a small paper on the back. And then I wanted to bring it. I said I was going to leave it at the hospital reception, and then she said, "No, come up here to give me a kiss."
Ah, that's how you two met for the first time.
Was it? And then I went up, I talked with her for a bit, but she was still in a lot of pain. She was, right? Her surgery, this last one, was really major.
You talked about life and death.
About death, no. At that moment, she was about to go to the United States for treatment, so we just talked about possibilities. I told Preta I have a friend who did an experimental treatment in the United States years ago, and she's doing well. She's here today. Now I think she's in Peru, she's turning 60, and right now she's traveling, And then
What did you say to Preta?
I told Preta about my friend Carla and said, look, there's this possibility. And then I even told her she really exists, okay? I'm not making this up to cheer you up, but I'm always very honest. So I said, I know it's not easy. I know it's a difficult process. It's painful. So I think we talked about it, and she was very, very impressed. I said no because I'm going home, not sure what. They asked if with my parents. No, I live alone. Then she looked at me kind of like that. And I said I had just broken my coccyx. So I said no, because I was out on the street alone. I fell and broke my coccyx. Then she said, you can't go out alone anymore, right? I said, I can. I'm going to keep going out alone. And then she was kind of like, wow. I think I was really, I don't know, that's just my guess, but she didn't know anyone else who was sick like that.
She didn't know?
That's just my impression, you know? So sometimes I would tell her certain things and she would be like, wow.
But why? Do you think that because she was famous, she ended up being shielded from other social interactions? Yes.
Oh, thank you. I don't think so. I don't think she was shielded. Thank you. I don't think she was shielded. From other social circles, I think it's about the group of people we interact with. You know, it's very common for us to be around people who are similar to us. So, like, she had people around her that I don't interact with because I don't like parties. I'm not someone who goes out much. And when I do go out, I like to go to the theater. She wasn't into big parties or anything like that. So she had people around her with that kind of energy, you know? And I really only got to know other people who were sick when I started getting involved with the Anami Institute, when I started going to those other places. Because even after I left healthcare, I didn't really have that. I interact with so many people, and then being around more people who are sick, that's powerful. So I say one of us because that's how it is. When we've been sick for a long time, life changes a lot, right? So that's the impression I got, but she never told me that. Oh no, that's just an impression I had, so I could be wrong.
How did you take her death? What did you feel?
It's always hard when one of us leaves. I also had to deal with the death of a friend of mine. Preta really died. Then you say hi? But I'll tell you what hurts me the most, just a little, is that I found out later, you know. I rely on the media since I have no one to help me reach her. They said she died in the ambulance. I fight hard for one thing, a dignified death. And then I think, what a shame, because when we realize we're actively dying, right? We know that the person we can offer comfort, you know? And then I'm like, wow, what a shame it was, even though she had some very close days, right? Carolina Dickman talks and all with the people she loves. But I thought it was a shame she died in the ambulance when I found out. Me, Zanotto,
What you would expect that it would have been at home.
or at the hospital, but you're still being cared for, right? She was in the ambulance with strangers when she suddenly felt sick. And then, obviously, we don't get to choose that, right? When we've been sick for a long time, right? And sometimes we can almost plan for it, right? You know, the illness is very advanced. Sometimes we know the person is stuck, about to die. And then, right? So I have a friend who knew, right? She was in the final moments of her life, so she was surrounded by the people she loved. She was in the hospital, but she was not in pain. The doctor was very careful with her end of life, so it's possible, right? Obviously, I don't know, in the case of an accident, we can't, but it's possible, right, to offer this. And I think we have a bit of a taboo when it comes to talking about this issue of passing, of the time, of death, and everything else. But I think it's an important subject like that. Thank you.
Should we talk about death?
I do, I do.
Who have you talked about death with? About your death, about the day you might die.
With my doctors,
With your parents?
with my parents.
And what did you say to your parents?
One of the things is that I want to be cremated, that I don't want to wake, I don't want any of that. For me, the body, I have a very strong spiritual side, but for me, the body is just a body. It's over. That's it, you know, like that. I don't want my ashes anywhere, I joke. I say, just leave the ashes there because for me, that doesn't matter, you know? It's over. The physical part is over.
It's over, and the spirit.
I grew up in a spiritualist family. So I believe there's a continuity that will be welcomed when we die, you know, that our spirit is welcomed. I really like the idea of spiritualism, of the colonies, you know, that we'll live another life there in colonies.
You hope for and expect a second spiritual life.
Yeah, I think a lot like that. I really like Umbanda, especially its symbolism, the Preto Velho and the Caboclo. I really identify with that, and I also really identify with the Orixas. So, and for us in Brazil, that's common, right? We visit a terreiro or center, even a kardecist one, but suddenly the Preto Velho and Caboclo appear. I was raised in a center like that, where there was the Preto Velho, there was the Caboclo, there were the Eres, who are the children. And now here I am still in it, right? I feel good inside centers, inside terreiros.
But when you think about death, you also think that you're going to another existence.
Story, yes, yes.
Can you imagine what that will be like?
No, I'm just saying it's good that my grandmother hasn't reincarnated because I want to die. I want to meet her and my two dogs. I joke and say, I don't want to know about that.
Why did your grandmother make that decision? And the dogs?
Because I want to see them again. They died, I miss them, so I want to see them again, my grandmother and my dogs.
I had a photo here. There are so many photos here. It's this one. Your grandmother is my grandmother. Very close.
You're from the Estancia family, and we're definitely the closest to our upbringing. She died in 2020. It wasn't from COVID, but she died during the pandemic. I couldn't say goodbye, so my mother left my house at that moment in Campinas because she was in the active dying phase. My grandmother, right? The doctors informed us, and then my mother went to say goodbye. She died in the hospital, and I couldn't have that ritual that we have of visiting her, or the wake anyway.
Do you want to meet her someday?
Yes, I want to meet my grandmother. And Teka is no, this is Chico. He's new. Chico belongs to my brother. This is Chico.
Mel and Teka are two, a little dog or a little female dog.
Both little female dogs died. Mel lived with me for 15 years and Teka 1 week. She died from distemper she contracted at the shelter. And Chico, my brother, rescued her from mistreatment.
Yeah, there are other little ones here with me. Look.
Nina and Mafalda, they're here. They're my cats, my companions. I say they're my little family. The three of us.
You live together, you and those two there in Campinas?
That's it, just the three of us. This is Mafalda. People say you can't tell, but it's Mafalda. And this is Nina. What is it?
You can't tell, but you know?
Yes, yes.
We were talking about Preta's death, and recently someone died who, I don't know if you knew, but I did because at the time she had written a book, Anami. And we did it, if I'm not mistaken, it was during the pandemic or a little before. We did a live stream, to talk, because I had released a book, she had released a book, and we were going to talk about books, talk about life, and she had an ending. I didn't follow every moment exactly, but what I saw was very beautiful. Yeah, when she died, her friends and family posted a video of her dancing. That was her wish. Yes, did you know Anami?
No, I joined the institute right after she died. If she died in February, I joined that same month. It was really close. I joined the institute because a friend, a speech therapist, told me I had to go and get to know it. Germaine, who was her cousin, also had breast cancer and was a friend of Anami. So the person I spent the most time with was Germaine. When she spoke, basically...
Germaine was Anami's cousin.
She wasn't my friend's cousin, and Germaine was Anami's friend. Germaine she was. She went to chemotherapy with friends, so it wasn't a sad or heavy day. She would take some friends with her to do chemo, and she always played some music for us to dance. So there's a video of me dancing, Germaine hooked up to the chemo, and us dancing in the hospital room. So I want to mention another person who I think gave a whole new meaning to life.
No.
Germaine passed away a year ago. She passed away a year ago. It was a difficult loss. She has 2 daughters, right? And 2 daughters, very young for you. She saw Germaine leave and saw that, right, leaving the children, right, without their mother's presence like that. And Germaine was very lucid. And then I remember that the last time I saw Germaine in person, she said, "I'm going to die. My daughters are about to turn 15 and graduate." She knew she wouldn't be here for that.
But she suffered because of that.
That's how she was. That's what we had. One time we were talking about a living will, and I was saying, I don't want this, I don't want that procedure, I don't want the other one anyway. I said, just let me go without all those procedures. Germaine said, do everything, because as long as I can spend more time with my daughter, with my daughters, I want to stay. She says, you can do whatever you want, so that's how she is. She had that. She had, right? A great sense of humor and a strong will to live. She also had a certain clarity.
Do you have any kind of clarity in that sense? Is that your perspective?
I think so. I think these illnesses are chronic and have no cure, and for me, that's a lot. It's very simple to be pragmatic. I think I have a very pragmatic side. I have all these illnesses, they have no cure. Well, then I'll have to live with it. I can't say, can I change bodies? I only have this one, so let's see what I can do with it. And that's it. These are diseases that progress, but they're not negative or progressive by nature. But in my case, Ehlers-Danlos, some people develop it in a much milder way, but I developed it in a certain way. It came on strong, it hit everything. I don't know anyone else who's lost their intestine.
I thought you were saying that it is. Sometimes people who don't have anything close to that complain too much, right? They suffer too much. Do you also get the sense that people can't handle anything, can't handle any pain? You developed a certain resistance, but it seems like you didn't grow spiritually, right? Did you develop yourself to face that?
Yeah, I talk about this a lot. The hardest conversation I ever had was with my rheumatologist. It was when I asked if I would ever stop feeling pain. And he, with a lot of regret, very carefully, he said, Bruna, you have many issues that cause pain. So he said, I believe that 100% pain-free is going to be very hard for us to achieve. And it was important for me to have that honesty. Like, okay, so let's understand, right? What are we dealing with? For me, it's always important, but we get used to the pain. I have glaucoma, and sometimes my eye hurts and I don't even notice it. I only realize it when the pain goes away. I put in eye drops, the pain lessens, and then I turn to the ophthalmologist and say, wow, it was hurting.
You get so used to the pain, you forget it's there.
You forget about yourself, right? Anyway, that's how I live with it. I really just go on like that. There are obviously pains that were very intense, right? I've had those moments. And I think it's really about each person's psyche, about each person's support system. This thing about complaining, I might have it. I even joke that my whole body is messed up. But I have a family that gives me a lot of support. I have many friends who give me a lot of support. So I'm inside the institute where I see that this happens to many other people. So, like, I think that socially I have a foundation there that supports me. It's not just my own support. I do my therapy and everything, but it has been fundamental all these years because, right? Obviously, it's not easy, but I think I have this support, which is important. And then I see that sometimes people who complain about very small things don't have this support. And then it gets hard to even hold the glass. So this way I can handle a lot of things, but these things are being shared.
You have support, so why do you live alone with two cats?
Someone doesn't need to be present. It doesn't have to be physical. Recently, I met several people in person, including my psychologist from the Institute, and that's how I did it. Oh, Chris, I like you for free. I had never seen Chris in person, but we made a bond and we liked each other for free over the internet. I don't need it. I'm not the kind of person who likes hugs. I'm not that person. My parents are present. My dad always worked a lot. There's a story from when I was a child. I was 2 years old. Since my dad worked a lot, he was rarely at home. So he was resting and I wanted attention, so I threw a glass of water in his face. It's very symbolic. My mom tells this story. I don't remember it, but I know it because she does. Then one time my dad said, one day you guys are going to hold it against me for being away for so long. I said no. Because he was always present, even if at that moment he wasn't physically there. But I always knew I could count on my dad. He's there. My mom isn't in the same house, but I know. And I'm very lucky to have a lot of friends, and I'm the kind of person who nurtures friendships. So the friend who was, we're still friends to this day. Recently, I had lunch with my high school teachers. So I like to maintain friendships, and because of that, there are a lot of great people around me. The weight just lifts. I'm not carrying it alone, even if it's just in my body, but I'm not carrying it alone. There are a lot of people with me like that, so I feel that very strongly.
And my boyfriend.
I was in a relationship with a violent man. It was a case of domestic violence back in 2000, and I separated in 2018.
What happened?
It started with breaking things at home. He had an abusive way of treating me, something like that. Look, you're not that smart, but if I help you like this, it wasn't obvious, okay? But the situation was like that. But I'll help you write, and then it'll turn out well. He brought up something very sensitive for me, my writing, which I still struggle with today. And then he would take what I was gonna write and he would mess with my writing, but always making you weaker and weaker.
He was a writer?
Not a statistician. Yeah, and I was doing my master's in linguistics. So it's this power to keep making you more and more vulnerable. He would say things like, if I wore lipstick, he wouldn't even look at me. If I tied my hair or put it behind my ear, he would criticize me. Depending on what I wore, he even left me alone on the street because he didn't like it. He didn't approve of the clothes I was wearing.
But it turned violent?
He threw a couch at me. That's why I understand that it was meant to hurt me.
He threw a couch at you?
Me. He was having a breakdown, right? And then he was breaking things and all, and it was a folding plastic door, you know? And then it's easy, right? So I managed to open the door. And then when he saw me, he threw the couch, and the couch broke.
The door injured you.
No.
And then you left.
No.
You didn't keep living with him, uh-huh.
It took a little longer, and then I realized that I got sick. Yes.
And Stockholm traffic.
No. You start to feel embarrassed. I'm maintaining that situation. And then there are things, you know, that the person says that put their life at stake. Like, if you do this, look, you treated me this way, I almost did it, I threatened my own life. Yeah, so he would do everything and you just go along, it's all tangled up like that. And then a psychoanalyst once told me, yeah, they drain us. You end up in that situation and it's really hard to escape because it's a cycle of violence. That's exactly what it is. But when they're being nice, they say, wow, only he could put up with me, right? Only he thinks I'm pretty, only he does. I think you're smart, and then you stay, you think like, I'm trash. So like having the strength to leave that was it. That's what I used to say. I'm alone because I had to have surgery, right? Because of the infection, he went to Uruguay. My mom had to go to Campinas to take care of me.
The whole thing began with the dentist. Yes, he had left you there.
He went to Uruguay. My mom stayed with me, and he never asked how I was. And I remember texting him because he hadn't asked. And then you start making excuses like, oh, but he's really busy there, right? Oh, I don't know. And then later, after a lot of therapy to look at this. Yeah. So yeah, it was a very difficult relationship.
And it was your last one.
Wasn't it? After that, I had a boyfriend who also wasn't nice, and that ended even faster. I broke up quickly, but then chemotherapy and the pandemic happened. I realized I was doing well alone. But why would I ruin that?
Not interested in dating today.
No, I sometimes joke once I spoke to a physical therapist. If a prince on a white horse comes to my door, I'll just keep and adopt the horse, sending the prince away. Laughs.
We talked about Anime. Do you think she was an example, that she set an example, that she brought a lot? Palliative care is a topic you care about too, right?
I think we talked a lot. That's a legacy today. She left a legacy, and we're keeping that legacy alive. We're keeping the flame burning, right? What is the legacy? So she was the one who, before it was just the group, right? She created the little house, and it only became the Anime Institute later. But when she started giving support to patients, people who were vulnerable. And it was through Facebook, right? People from across Brazil joined Facebook, and she began building a community. Then the patient support groups were created, where I volunteer in the patient support group, and there's also a support group for family members. Nowadays, we operate on another platform, not on Facebook anymore. We use Circle and Fora. Her books, right? Before joining the Institute, I read all 3 of her books. And to bring to the discussion that the patient is at the center of everything. That's what I believe in. So I believe that we have to make our own decisions. We're together to make decisions. We're together for that. Sometimes it's like this. Look, you're in a lot of pain. If you take this medication, you'll have X side effect. Is that what you want? Or should we go another route, which is a less effective medication? Sometimes these conversations happen, and Anna really believed in that the patient is at the center of everything.
As opposed to the doctor.
As opposed to depending on the doctor, because she herself went through very difficult situations.
Similar to yours.
She talks about when she saw what was written, which before was, I don't remember what the opposition was. On the paper she left at the hospital, an X was marked on palliative, which was her first shock and introduction to the word. The doctor didn't talk to her. And we have this idea that palliative means when someone is at the end, she explains.
For those who don't understand what palliative means, why was there an X next to anamyocardial infarction?
The care in this case, the X meant that it was already a metastatic cancer. Metastatic cancer becomes a chronic disease. They discuss remission, not a cure. I know people who have been in cancer remission for 10 years, but that's it. It's no longer a cure. So they're still taking maintenance medication to this day, whereas we have a cure. So, for example, I know a woman who had a bone marrow transplant. After 5 years in remission from the disease, she was considered cured by the doctor. A metastatic cancer won't be able to have a cure in that sense. It will become, just like in my case, a chronic disease.
That's when palliative care begins, and then...
In that sense, on that day, palliative meant that the cancer would no longer be curable. The treatment would be chronic, for maintenance. To control the disease, we want to keep it as quiet as possible for as long as we can. That's what they were going to try to do there. But that conversation never happened.
She was told she could die at any time because of that X.
And she got really scared and everything, so there's that. I don't remember exactly where she tells this, maybe in the book itself, I honestly don't remember. But then she took it and she transformed it. She took this palliative and turned it into something good for the world.
She created the palliatives.
The palliatives. She and Renata, her friend who died before Anime. But the palliative care team, they will look after the patient's well-being in every aspect. So they will look at the physical issues that are happening, social, spiritual. So they try to embrace all aspects. They try to provide well-being. Because it's not just about fighting the disease. I don't even like this idea of fighting or battling and so on. No, because if I consider that I'm fighting against it, my friend who passed away, she lost, she didn't lose. She lived with the disease. When she passed away, Germaine didn't lose or fail. She didn't lose a battle. We think about that, so we don't like to...
So you're not fighting?
I'm not living by taking my medicine. My life is different from most people.
Are you considered a palliative patient?
Yes, I have serious illnesses because that's how people with serious illnesses enter palliative care, not necessarily without a cure. So, for example, someone who has just been diagnosed with a hematological cancer like leukemia can benefit from palliative care because it's a serious illness causing much suffering. The treatment for leukemia is difficult, so palliative care comes in, providing support for the well-being of the patient. They'll care for my family, supporting them as my family supports me. That's what palliative care means. They will want to embrace the family as well because they know the illness is affecting the family too, so it's about looking at all of that. And the one who said this into the microphone was Nami. To define palliative care,
The need for palliative care for everyone in the public health system, especially those currently without access.
now they do.
It's that
The law was passed. Now we have to have palliative care teams. Now, yes, we know that, right? The wait will be longer. I know people who have access to palliative care, not through unified health system, but this person even said, oh, I'm an exception, because they understand it's a process. We were at a gathering, and then inside a hospital where there's a strong movement for palliative care, the nurse said that many doctors don't understand what palliative care does and don't refer the patient. So we are looking for...
But it's just at the very beginning, right? There's still a lot of information missing, still lacking. It seems Brazil is only now beginning to consider the importance of this and starting to spread it. What do the doctors tell you? Does your disease have a cure?
No, neither lupus nor Ehlers-Danlos has a cure. The medications I take, we can adjust the dosage, but there's no cure. And so, for example, my spine, which was the last surgery I had, was a more difficult recovery. I tell my doctor once you opened up my spine, there are some surgeries that we have. And it's like, oh, you remove the gallbladder, life goes on. You remove the appendix, it's fine. You recover from that surgery and you feel okay afterwards. I get the impression that with the spine, they only operate when it's really necessary. So my spine really needed surgery. And after that, you end up having limitations. She needed spinal cord surgery, which was a tough procedure for her recovery. I was recovering from that manipulation that had to be done on the spinal cord because it was really a vertebra, right, that pressed against the spinal cord. And so I say, this spine that I have now, which already has osteoporosis, it's not going to get better. I'm very practical.
Are you certain your spine won't heal? It won't.
Because there's no way, right? You had the surgery, so that's how I am. I was losing strength in all 4 limbs, so I'm better than I was before in terms of symptoms. But I understand that we manage things here like this, we just go on. I say it's like a bunch of little plates we're trying to balance, so the corticosteroid is there because otherwise lupus flares up. But then we have another little plate here that now wants osteoporosis, so that's the surgery he had. They put in the screw, right? I'm not sure if that's the right word, but to calcify there, having osteoporosis, it's much harder. So it's a body that's worse off, let's put it that way.
Worse than 8 years ago when you found out about the disease.
Oh yes, that's true. I had times when the disease worsened. With vasculitis, I experienced choking and neurological symptoms. But yes, the body is on its way. That's why I say something that really shocks people. I say it. I don't want to get old. I don't want to be 60 or 70 years old.
I want to die before that.
I do, because I'm already 35 and I already have a lot of issues. And the body isn't going to get any better, right? This back won't get better, right? People find it strange when I say that, especially my doctors who say, Bruna, but it's getting harder and harder. The challenges are getting bigger and bigger. One day I'll decide I've had enough pain.
I don't want to live anymore.
Because when the pain is unbearable, for now the pain isn't unbearable. It hurts, but I can manage it and get around it and live. But if I get to a point where, wow, this is very personal,
But if that time comes,
then I give up. I'd rather die. I don't want to. I don't want to be alive at any cost. I think that's it. And I understand that as time goes by, my body is getting more deteriorated. Come on, this has nothing to do with me becoming a person with a disability. It has to do with symptoms, really, with the illness, right? And not with the disability. I think that's important, right? To separate the two things. The illness hurts, the illness limits me, the illness makes it so I can't plan a trip because I'm always dealing with it. It's a treatment I have to do in the hospital. I don't know what. It's hard, so that's the illness. And then when the pain becomes unbearable, that's okay. One day I'm going to die anyway, but I don't want to live at any cost. That's very important to me. For me, I have this clarity. Maybe I have clarity.
do you ever think about your death?
The day I die, I doubt it. It'll just happen eventually. I just want to be as comfortable as possible. Isn't that what everyone wants?
That's why you left a living will.
So like that, I don't want to be on machines or mechanical ventilation.
No tracheostomy.
The tracheostomy, I don't want it.
Even if that could prolong your life, you don't want it, right?
Because that's what it is, living at any cost, right? And again, that's very individual because there are people who will say, I want to be alive. Do whatever it takes. Like Germaine said, do whatever you can so I can live as long as possible with my daughters.
Even if it's with machines.
Yeah, we had that conversation at the Institute.
What does your living will say?
Oh, I remove those procedures that keep someone alive artificially. So ventilators, tracheostomy, tube feeding.
You clearly don't want that.
Feeding tube. I've had a feeding tube before. It's kind of funny because I'm a speech therapist and speech therapists work with that, right? I've had a feeding tube as a speech therapist.
Right.
I've had a feeding tube before and don't want another. So at that time, the feeding tube was because I had surgery. So it was a situation that was in a process where it was going to be resolved. It's different from a living will, which is used when the person is unconscious and in an irreversible situation. So you let the disease take its natural course. Yes, but it's a very serious situation where the person is unconscious.
If they come to you, then do you want everything off?
It's not about turning things off, guys. There's no such thing as turning off. It's about not intervening. If oxygen saturation drops, you won't intubate, right?
You don't want to be intubated, right?
For example, people are often surprised, but that's how it is. I'm going to think about my grandma here. My grandma, she died. She was 80. I don't know exactly, but around 85, about 85 years old. My grandma, she was semi-lucid. She had moments like that where she opened her eyes and everything. The doctor asked my brother, if she stops, do you want to resuscitate her? This is a common hospital conversation. Why didn't they intubate her? Because they knew that if she was intubated, she would stay on the tube, but she wouldn't get better. The tube wouldn't help, right? During COVID, intubation saved many lives, right?
But there was a cure?
But there was a cure, right? There was a way out of that, right? So many people were intubated and are alive thanks to intubation. For my grandmother, that's just suffering, which I want to avoid. And from the moment I write it down, if the doctor asks if I want to be resuscitated, I don't want it. It's not my brother or my mother who will have to make that decision. I take that responsibility away from them because I made that decision for myself beforehand. Because just like I want to be active in my treatment, I want to make decisions. I make those decisions for myself at the moment of death. And I think that's important. You really do take that away, which was tough for my brother to hear.
He heard?
What is it? When they asked my grandmother if she wanted, if she would be resuscitated, if they would use a defibrillator when she stopped or not. That was the doctor's question. That people, so we move on.
Your mother said she still hasn't read your living will?
No.
She hasn't.
No, and she's not one of the guardians of the will, so she doesn't need to.
Her brother is a guardian. Ma'am?
My brother and a few friends, including one from the institute I talked to like this, Jew is already used to it.
Do you also support euthanasia?
It's not euthanasia. Euthanasia is, for example, not even in Switzerland do they have euthanasia. It's assisted death because it's the patient who does the act. Assisted suicide is assisted suicide. It's the patient who will do the act, right? For you to take the medicine or anything else to die, and then we discuss assisted death. Because again, it's a matter of dignity for me, just like I seek dignity. Sick or not, I'm alive until the moment I die. So I want it because maybe I won't need or want assisted death, but for me, it's an individual right. For me, it's not about religion, since I already have my own beliefs. I can't use my beliefs to decide someone else's fate, so I really believe in that. We have an important religious barrier regarding this in Brazil, because people use their own religion to decide the future of someone else's body, right? So I think we have the right to choose to have a dignified death, and there are illnesses that are very difficult.
And then, if you were in a situation where death was imminent, would you take the medication yourself to die?
But if I wanted to anticipate it, because today what I can do is refuse treatment, and refusing treatment is not assisted death.
If you refuse treatment today, you would die.
Oh yes, if I stop the medication.
How many medications do you take?
It's roughly 20 per day.
If you stop taking this medication, you die. Oh, okay.
Yes. So today I make the decision to take my medication on time. I make the decision to exercise.
That you want to live?
Because I want to live. So it's not a morbid thing to fight for assisted death. We want dignity. I want dignity for people to live. Even if they're sick, I want dignity so that people can die with dignity. And I'll say more. I found a guy on Instagram who I thought was amazing. The guy is into topraxia, right? So he prepares the body of the person who has already died for the wake. And then he said, like, this body, he deserves dignity even after death. So he's someone who deals with the dead body. And he treats that lifeless body with dignity. So I always thought about living in an act of dying. And then I found someone and I said, wow, this guy, he looks at the body too and says this body has to have dignity. I thought that was really, I found out about it not long ago and I thought it was really cool.
The case of the poet Antonio Cicero was remarkable in this regard. For you, was what he did important, the decision he made to go to Switzerland to die?
I don't think so. For me, what's important is that for me, this is individual, you know? He respected that his illness was an unbearable pain. And some illnesses, denying treatment will be a very long and painful death, right? And the process, some illnesses have no treatment, causing the person to gradually get sicker and live a life of unbearable suffering. He said, no, some people say, I can live like this, but I can't.
Despite everything you've told me here, first of all, you seem very well to me. I look at you. I see someone who smiles, jokes, is joyful, and has a will to live.
So,
how do you find the will to live despite everything you're facing? A lot in them, in the kittens?
Is that it? It was an important change. So there's something in psychoanalysis, which is the life drive. We need a life drive. And then I was in a moment where the death drive, which isn't exactly about death. Back then, I couldn't even mention death and had no perspective at all. Oh, everything's fine, anything is fine. In therapy, we reached a point where we realized we needed this. It was during the pandemic, so I couldn't do the theater activities I enjoy since there was no theater. And then I adopted the cats. And after I adopted them, the psychoanalyst said, this is an important point in your drive for life. We don't think about it, but a pet, it's a drive for life for a lot of people. Like, it makes a difference. Elderly people who aren't sick but are experiencing significant aging, so they've lost people already, right? Because my mom sometimes jokes like, it doesn't seem like I'm going to be the last one to turn off the lights, right? When a lot of people die at the same time, you know? It's hard to get sick and see things like that from family, for example. My grandfather already lost his wife. He lost that. My grandfather is alive. He's 93 years old. Yeah, he lost his wife. He had already lost a son, a baby. He lost siblings. And then the person goes, it's very hard. And then you show up with a life, right? So for me, the animal is Chico the cat.
But where does your happiness come from?
I know, I think I have it. I think it's something you build. I don't think it's just one thing. I think it's all of this, you know? I have many people to talk to and friends to share jokes with. Why keep a good joke to myself? Do you do the same? Oh no, I have my friends, right? And I think all of this motivates us to want to live too. My cats are very important, but being able to count on my family, having my brother call me a dummy, I think that's really necessary.
And the drums?
Drums, I've been playing for a long time, since I was very young, like since I was 12 years old, and I'm still here in my early 20s. And then, when I lost movement in my right arm and right leg, when I recovered, obviously the issue was there, but when I regained movement, I needed to exercise, right? And it's still not, you know, the ideal way. I still need to improve and everything. So I decided to go back to playing drums and taking tap dance lessons.
And this photo of ours
Was sent by my clown of a mother. I like musicals, and then I turned to myself, then I turned to my friend. And we've been watching musicals since we were 18. I turned like this. I'm going to paint myself green, since nobody ever threw a damn costume party for me to go as Elphaba, so I painted myself. And you? Posted this video here.
What was it, that day?
I was bored in the hospital while getting something out of my intestines, so I always saw this, then a scooter, right? So I was riding around inside the hospital room, like this, and my mom, she's an accomplice, because she's the one recording the video, she's the one laughing in the video, and she even drove. See that door over there? Look. There's another video where she said, I'll stay on the other side of the door, then you go through.
My mom is a film director.
She said she would stay, and she did. It's funny. Seeing her through the little window is nice. She's an accomplice, even at the hospital. We try to have fun in some way.
Since we're talking about fun, we're living here remembering pleasant moments. I'd like to invite you to have a pleasant moment in the kitchen with me. Let's go to the... And you have a microphone to serve you. Like we talked about here, as we agreed.
I love the mug.
The mug, one of them is yours. Actually, you're going to get this mug. It's only for those who come, because it says on it, I was here. So, in our second act, sometimes people cook, and since you have a gift for cooking, when we met, you told me. I thought it would be nice, so we prepared the recipe you sent us, right? There's flour, cornmeal, oil. What else do you want? Baking powder?
I'm diabetic, so there's sweetener.
Sweetener for me, sugar here, and
Water.
needs water. And I heard that you love Coke Zero.
I like Coke Zero.
So we brought you Coke Zero. I also heard that you're doing tap dancing, or rather you did.
I did it when I was a child, and I gave up quickly. Then, after this spinal cord injury I had, I thought, I need exactly the movements that tap dancing works a lot. And then I have a friend who is a tap dance teacher. I asked Carla if she was up for it, and she said yes.
So that's good.
So she agreed with me. I stay at the bar, so I don't fall. But it's helping a lot. My doctor was like, wow, never.
It's impressive how you do so much. Playing drums, tap dancing, and more. Cook.
Cook, I like to cook. I'm at the Anami Institute,
Are you a volunteer?
I'm a volunteer with the patient group.
And you still see your speech therapy clients from home, and you take care of your cats.
The cats. And I'm also part of the Kawe Institute, where we work on the inclusion of children with disabilities. Then I joined the I Decide project.
Which also takes effort, yes.
Yes, and we're just starting the I Decide project, right?
Let's do your experiment then. I'm curious. It's a microwave dish.
It's vegan, contains no animal products, and is microwavable.
How come? Did you become vegan?
I was actually vegan for a while, but I have osteoporosis. And because of gastroparesis, what kind of vegetables can I eat to get enough calcium besides what I already do? Supplements? I couldn't do it, so now I eat some dairy products for my health since I couldn't change.
Did you used to eat meat?
So it's not a choice. Do you like meat? It's not about health, it's not because of the animals.
Sorry?
So I didn't stop eating meat because of the animals, right?
Of course, I understand. You said you would save the horse and leave the prince, exactly.
So I am who I am. Even when Mel died, in 2018, I had already been a vegetarian for a while. And then when she died, when she was about to die, I turned to her and said, I promise I'll never eat an animal again.
Who did you promise that to? To Mel?
To my dog. She was already dying and very sick. Then I promised her. Because sometimes as a result I have to eat but actual meat, and I used to eat steak really rare, like...
You mentioned the horse in the prince's story, right? It reminded me the French still eat horse meat to this day.
That's it, guys.
Horse meat? There are restaurants that serve horse meat?
So veganism goes beyond that, right? Even though I have to eat the byproducts, I don't think we should be riding horses. I don't think animals should serve humans. That's what veganism is about, right? So not even consuming honey because it's an animal being used to produce something for humans. So
it's like enslaving that animal. Exactly, it's enslavement, right?
So riding, I used to ride horses when I was younger, but today I would never ride a horse. Yeah, rodeo. So for God's sake, I say, like, guys, it's 2025, come up with something else.
No.
Guys, leave that animal alone, like, okay? Because that's just hurting for no reason. I can't accept it. It's hurting for the pleasure of humans, for the sake of it.
Bullfighting in Pamplona happens in the streets.
That's for the pleasure of humans. I can't handle it.
You need a little stool? No, let's not. So here it is. I'll do this. I'll stay by your side and learn this recipe with you, okay? I'll just put this other microphone here for you. And I was hoping you would make a dish here, but I guess it wasn't the right time, right?
And not talking about how the kitchen was, it would be hard, right? Because, vegetarian, using the blender a lot. Yeah, we transform a lot of things, right? So, I don't know, I make hummus, which is very simple, but then it already requires at least a food processor or a blender, those kinds of things.
And how did Coke get into your diet worse than Coca-Cola?
I drink it because it helps me with digestion. Mine is really slow. And then I say here that it's sparkling water. It doesn't have that much fizz, so soda. And it's like I'm having a soda after lunch, like this,
It helps and you like it.
I like choosing things. You go, right? I picked Coke.
Let's go. You're going to teach me. I'll put my glasses on since I can't see otherwise.
Let's go. 3 spoonfuls, 3 of flour.
Let's go. Let's serve. What's the name of the cake dish?
Of mug cornmeal cake?
Mug cornmeal cake? That's 3.
3. It could be that one. You counted 2.
It was very full.
It needs to be this shallow, okay?
So mine was full, it was just 2. Okay.
Okay, now 2 of cornmeal. You can take this one.
It's better if you do it for me or I'll use too much.
Since adding water means I can't fill it completely, just consider the proportion, okay? With liquid, we can't create a mound, so the spoon always stays level.
Cake with water usually... Wait, is it vegan?
But I grew up with birthday cake that uses water, warm water, and it was made in the microwave. My mom used to make my birthday cakes and my brother's in the microwave.
Since I was little, only she made them.
Microwave course, because I was there at the beginning of microwaves. It's 2 spoons of sugar, and if you want to add sugar...
I'll go, but not with this big spoon, right?
It's 2 tablespoons of sugar. I don't like things too sweet.
I'm going to put less, okay?
Yeah, it's me. But there's an issue with vegan food, and that's where pre-diabetic food loses a bit, which is that sugar gives structure and moisture to the dough.
So...
that might make one cake turn out different from another. There's also the amount of baking powder. Consider this here, half a spoon of baking powder.
half isn't really half, right?
It's half a tablespoon, so you can fill this. Now the tablespoon again, I need to add a spoonful of oil.
You added it since I might be clumsy.
And it's like I told you, I can't fill it up, so you have to think about the proportion. There's a fork.
Fork, there's one here. Ah.
There's one here. It's true, because it's easier to stir.
We stir with the fork.
So I'm gonna put this here. So 3 spoons of ammonia. My first cake ever was this microwave cake, and it turned out well.
The first time.
My mom was there. She had sprained her ankle. She couldn't cook.
And you have to beat it a lot like this. It's okay. Here and now.
Microwave now.
So there's no mixer, there's nothing at all, and it's going to turn out fine. Just leave it nice and neat like this.
Isn't it good? It'll rise a bit.
We're not going to use this fork anymore, right? There is, look, so mine is marked here, so I know which one belongs to the teacher.
I've never made 2 mugs by mouth.
I think it's better. You don't want to take a risk. It can't be. Do you think there could be a mug accident?
No, he's distributing energy, so it may take a bit longer than 3 minutes.
No.
We'll try 3 minutes first, then put it back in if needed.
While we wait, I'll suggest something if you agree, okay? A little game, a small game. I have a deck of cards with some questions that aren't necessarily easy. All right, so let's go. Let's go over there. And then you pick a card. And then you read it. Read it. The question for me?
What is your earliest memory? Wow.
Do you know why this question is here? There's a novel called 11 Weeks by my friend Hernani Lemos, and it starts like this. That the oldest memory reveals a lot about a person's story. You can remember what it is.
I have some memories from school, like being there. I recall it was my first school, and I was in either preschool or kindergarten. So I have flashes like that of the school, of a girl biting me. I have that. I'm resentful. I'm a Cancer. Her name is Amanda.
You never forgot, and you never will.
Isn't that hell?
But you already got revenge on Amanda?
No, I was way too nice.
Ah, you were nice.
I was really passive.
Do you consider yourself nice today? Not yet.
No, but there was a time when I was already in school at 13 years old. And then girls like bullying, calling home, making prank calls. And then I asked my mom to go to the school, but she said I had to stand up for myself or they wouldn't respect me. So I hit one of them. And my mom said, yeah, you didn't really need to hit her, right?
But I said defend, not attack.
At least. And then my mom says it's been since that moment. So my mom says that's the turning point when I changed a lot from then on.
This smell is normal.
Okay, I think it smells a little.
Smells like cake, right? I'll throw you another one. Oops, never mind. It seems implied, but I didn't suggest the card.
No, I chose the easiest one. If you could travel to the past without being able to change anything, which moment would you choose to observe our...
Any moment from the past? If you could go back, what would you want to see? Which scene from?
Not just from my life, but anything.
Not humanities or your own history?
I enjoy politics. So I think about movements we've had, like, I don't know, Diretas Ja, like when people took to the streets, when there was a movement, and I didn't experience that. I think that, like, Diretas Ja is something I see that way. We have really beautiful images of it, I think. I think I would have liked to witness that movement itself.
I see that as nostalgia for a more united Brazil before today's polarization. At that time,
I don't know. I think people had a bit more clarity about things. I think the polarization. I don't know if I can express myself politically here.
here, you can do anything.
Yeah, I consider myself left-wing, and now many people will hate me, but that's okay.
But I don't think so, right? Because our channel here is based on the principle that everyone should be heard and respected. Yes, that's my principle, which I take very seriously. If someone is watching us and they just want to hear what they've already heard, I'm sorry, I really am. So it's not a problem if this person is bothered.
I consider myself left-wing, but I understand. Many in my family aren't, and that's okay. For me, what's important is that I see a complicated political issue when a country's leader mocks people who are short of breath during a pandemic. So, like, for me, that's a really big issue, and at that point, I don't think it's about me having respect to listen to him. I think he crossed the line and he went too far. He offended people, so, like, when people take stances that offend the existence of others, I'm going to have issues with that person. And you already had issues.
You were already sick then, so it must have impacted you even more.
A lot, because there was a moment when the former president, had issues with medication. And it's not just me. I know a lot of people who depend on it. I get medication from Unified Health System, right? But if there was a problem and Unified Health System ran out, I could buy it. But there are a lot of people who can't, right? So he offended the existence of many people verbally and many times through actions. And we know that, right? And so that's why I think I can't label it as just a left-wing movement. Many people disagree with him and they're not left-wing. With the former president?
With Bolsonaro.
That's it. With Bolsonaro, it's like that. It brought together people from the center, from the right, from the left, who are against Bolsonaro and who are like that, right? They're terrified of him, so I can't just put everyone on the same scale, It's an unfair scale for me to say it's just not wanting him to return to the government, No, it's that he should pay for what he did. It's the same as believing in people who mock, who make jokes about gay people, I can't balance the scale. I don't think that's the same weight. That's why I find it very difficult when people talk about polarization. But I think I understand that when we had the right, we were already a little closer to the end of the dictatorship. People were realizing that it's not just a possibility, that there were people who actually died, right? Because there are some people who think that NFO didn't suffer,
His grandfather was an Air Force pilot, and just for being against the coup, he was hunted down and never flew a plane again. I understand. My grandfather's family was ruined by the dictatorship.
It's not possible.
You can't deny it.
No, you can't. And then we see people wanting in front of the barracks wanting the dictatorship back. And then at the same time, they want freedom of speech. It's completely contradictory, right? But I think at that moment, people were fighting for a democratic Brazil. So, like, regardless of who you were going to vote for, oh, you were going to vote for X, I was going to vote for Y. But we were already together because we wanted elections. We wanted to have the right, to decide who will govern the country and more. This polarization is really crazy in my view. It's one side that doesn't respect the other, the one that's different, right? How come? And then he got to the point where he didn't respect something I really value, right? My therapist says it hits my morals. Like, how am I going to make fun of someone who's sick, almost dying? I can't. It hits my morals. It really affects me. So, yeah. And then, anyway, so we're at this moment of judgment and everything. And that's it. Yeah, that's him. That's good. This is a big step forward for us, right? It was the first time we're seeing military officers being tried for attempting a coup. Yeah, I think that's it. That movement that once existed. Of a country that knew it couldn't live under a dictatorship. That it couldn't live in a country without respect for what is right. I think it was almost like a therapy session.
This now.
Now.
So let's eat the cake. Come on. Well, you're the boss. I'll let you finish. Now, I'll need to wash. Few forks left. There's a fork shortage in our kitchen. Hold on.
Notice our sugar difference. Hold on.
Let me see. Look.
I told you yours would rise more.
That was expected.
It's the sugar. It gives structure to the...
Wait, let's go back. Oh, you're there? I'll stay closer to you. Do you have a spoon?
I only have this one here.
Do you want to use this one? Is that okay?
But in general...
I'm going to use this bigger one here.
No. He didn't let it all out. He didn't let go.
Ah, you have to let go from here. You do.
Or eat straight from the mug.
Yeah, I'll eat from the mug.
This little plate is fine to use. I found it.
Let's eat from the mug so we have something to hold. Why can't I believe this cake?
Because it lacks eggs and was microwaved? Yours must be better than mine.
It's good, yeah, especially when you think about a quick cake, right? It satisfies your craving. It's really good. I didn't even offer you, do you want cheese? No, that doesn't match. I want a grape. Do you?
I can't see a fruit.
Look, I'll ask you one more little question. When we eat cake, okay? It's cool because it brings things up, right?
No, that was very nice.
I'll shuffle so you know I'm not influencing your card choice. You always go for the middle, right?
So, if you could write the title of the current chapter of your life, what would it be? Wow. It's movement?
Movement.
Because it's the first time in many years that I have so much going on and that I'm able to handle so much. I'm here. I was at another event. I went to write the preface for a book on palliative care. I'm able to see my plays.
What are you watching?
I watched Jersey Boys.
I love it. I'd already seen a version in the United States.
I saw it too, did you? It was one of the most beautiful moments I've experienced from any play I've seen in New York. Frank Velli was there. So I saw Jersey Boys, right? Which is the story. He went up on stage and then I heard a buzz like, he's here, he's here. But on the day I went, Frank Velli The actor who played Frank Velli in the original cast, he performed. And then I started to think they were talking about the actor, but then when I saw, I said, no, I get it. It's the real Frank Velli, and that's what it was, the real Frank Velli, already old, He's 90 years old now.
Did you see this a long time ago?
2012, I think, and now I've seen it 3 times already because I really like it a lot.
I'm dying to watch it here. I saw it there twice.
It ends on the 28th.
Oh yeah, I watched it when I lived there. And you sing too?
Don't you? I took singing lessons, but I can't sing like that. It's a block.
I interrupted. You mentioned movement, so is this a new chapter in your life? Like the letter asked here, if you could write the title of the current chapter of your life, it would be movement, because you're recovering movement.
I think I'm recovering. I think it's not about recovering my life, it's in motion. When you're in a hospital for 50 days, the days are all the same. You wake up at the same time, have breakfast at the same time, the medicine comes, everything is the same. It feels like when you enter, time inside a hospital is different than outside. When I looked out the window, I would look and say, wow, the world is turning, cars are moving, people are doing things, and I felt frozen. Every time I was hospitalized for a long time, I feel like the time there is almost as if I hadn't lived it. Those 50 days I spent in the hospital, the 30 days I spent during the other hospitalization. So the sense of time is different during a hospitalization. And now I here outside the hospital, being able to do things I never imagined, things I would never have imagined being here. Talking to you, I even told the guy at the front desk, someone is coming to interview me and all that. Then he thought I was joking even.
Why is that? You didn't see anyone.
No, I mostly stayed home and I'm already a homebody. So being able to do all that, being able to be at the institute and see the work, that's it. I think that's living life, living my life by really staying active.
Are you familiar with Jorge Drexler's song Movimiento? You'll enjoy it. Give it a listen. It's a bit about this idea of being in motion. And I remembered you talking, it just came to me now, since you like music, I think you'll enjoy it. You hear the phone, right? Can I answer it?
Please.
Oh, well, hello. Oops, let me even take off my glasses. God. At this hour, we're talking here. But go ahead, of course. Always, always at your service. God is saying He just wants to listen to you. That's the only reason for the call. You talk to Him, I do, but I don't know what she's going to say, even if it's not, okay? Do you want to hear it anyway?
Hello. I need to make a request. It's very cliche, but I need to ask to stop killing innocent people under any circumstances. We can't keep killing civilians anymore. We can't keep seeing children in Gaza in deplorable situations. Of care, there's no care at all because in the middle of a war it's impossible. And then we can't understand a world that doesn't understand what's happening. And sometimes it's close to us too. Because there are children dying from stray bullets right next to us too, but that's how it is. I don't think we can keep killing children, especially killing children, right? I hope my request will be granted. Thank you very much.
He stayed silent and listened.
He just listened.
I'll stay quiet. What if he gets irritated too? And I think that brings us to the third act. Let's go, let's go.
I don't think so.
Okay. In that phone call you got back in the kitchen, in your conversation with God, you were pretty harsh, weren't you? You made a serious and fair request, right? for justice, decency, and humanity. Then I wondered, what kind of God do you believe in? Or do you believe in any God?
I don't think I can picture a single figure like that, you know? I think a lot about the Orixas, the entities. I think it's collective, you know? I think there's an energy greater than us, but I think there are many people taking care of that other space and of us too. That's how I see it.
Do you think the Orixas, right, which are from religions of African origin, they represent the many facets of what God would be? Or this God who for Christians, Jews, and Muslims is one? Everyone is actually talking about the same thing.
I think so, but I think the Orisha will add a bit more human characteristics, right? Candomblé, you know, the old black spirits, they have a human side. Even when the person receives, right? Sometimes the entity wants to smoke, right? So I think these religions, they bring a little bit of that, you know, characteristic that's still from the incarnated, right? Meanwhile, that's how I see it, right? I see that in Christianity, even in Catholicism, there's something very sacred, right? So Jesus, even though he was human, he was very sacred, right? I see the Catholic Jesus, and then you can correct me, but it's like he was a perfect man, right? So I see that in African-based religions, these figures aren't that perfect.
So I understand that Jesus had a quest that was very much about justice, which has a lot to do with your phone call. Yes, very coincidentally, the oppression happened in the same region, right? In the region that was known by the Romans as Palestine, there was a Roman occupation. And he had a struggle that was very human as well, yes, and it was very much for the people. It was very much for the well-being of the people. And certainly not all of Jesus' deeds have reached us, not all the moments.
But in much of that,
I'm really curious about that. And there are tougher moments of Jesus in the New Testament that people sometimes don't want to read. Okay, so I've already highlighted that in one of my books about Jesus. I show that there's even a moment when Jesus asked for the death of an unjust person, of a really bad person. It was likely a moment of fury, but that's in the New Testament, not Rodrigo saying it. So, this humanity, which we also understand as imperfection, is present. And the religious people themselves also make a point of highlighting the humanity of Jesus. When he, on the cross, questions God, why was he abandoned and why is he there? There is an imperfection. At that moment, he didn't understand what religion would later call the plan of salvation. Salvation, salvation.
yes.
He questioned that himself. So I have a very historical perspective, and I always make that clear. I don't deny it. I don't deny historical events. I don't turn a blind eye to what I don't want to see. I look at everything, and that's how we see things. There are moments when humanity was very strong in Jesus. That's beautiful. That's wonderful. You mean that, right?
Yeah, I don't have knowledge. It's really just study, right? And I think about that a lot. Like, about what we don't know, right? Because it's exactly what you said, right? It's been years, so we lack full access. I'm very curious.
When you're reflecting on your life, on your existence, where do you see yourself in this immense universe? Here. How is it? How do you see yourself?
I'm just another person. That's how I see myself. I'm just another good person. Living. I have a very simple view in that sense. And I think I go back to that. I'm not special. Nobody is. So I'm just another person in the middle of this world. With relationships, with flaws, with qualities anyway, I think that's how I see myself.
What is your greatest quality? I see myself. I think I know.
I think I'm resilient. I think that's a quality.
I think that's the impression I have too, but I find it interesting that you have this resilience with joy, at least in our two meetings. I realize someone can be resilient yet still suffer constantly. You resist, but you look for joy in the moments you live. You have a joy for life. Yes. That never goes away, yes. When the headache gets worse, it really shows, wow.
I don't think so. When you're in pain, you can't even think. I think I've had moments of questioning why I'm still here. I've done that more than once.
What do you think, Guilherme?
I think we don't have an answer because we can't see. I can't rationalize my friend having died and left 2 daughters when she wanted to be here, and that really got to me. Once again, I witnessed another death of a mother who also left behind a small child. And then I asked myself, isn't it possible to be rational? We'll never know why it was their time to die and I'm still here. I don't think there's an answer.
When we got that phone call in the kitchen, the idea that God was calling you, the joke there, I thought you were going to complain. If I were to say something about this illness that came to you, you never complained.
With God like that?
No?
No, because that's it. I don't think I'm special. Disease has always existed. It always will exist. Disease exists because someone has the disease. It's not something, an energy, no. Disease exists because people have diseases and everyone has challenges in life. Disease brings challenges, but one of the biggest challenges, I think the hardest ones, is the social challenge. Because that's what the disease is, right? I will seek treatment. I see that we have ways, right, to deal with it if there is no cure, to make it more comfortable. Now, I worked with people in very vulnerable situations. There was no treatment I could do to improve those people's lives, or that the doctor could prescribe the medicine. It wouldn't work.
In your case, you see that there is, I see.
I have it. What is it like to seek quality of life, comfort, care? And sometimes, I don't mean that everyone in a worse financial situation is sad. That's not it. But vulnerability, really. Misery, how do we... Donating a basic food basket to someone living in misery doesn't help.
I ask, it's also soul-crushingly exhausting. People who can't like others, yes?
Yes.
Who, as you said, kill, right? You mentioned Gaza, they kill without guilt. The goal is to take a land, to create a resort there, yes.
No, I can't. I just can't.
I've been to Gaza many times. I have an affection for that place, you know? And I'm very close to many Jewish people. One of my closest friends, Abir, who is like a second father, is almost Jewish, so I have no problem. I understand the pain on both sides. I lived and heard. And now what's happening there is an absurd inhumanity.
But that's how it is. These are things, and looking at it, solving it isn't much harder than taking care of and comforting someone who is sick. You see, I have this perspective.
I can tell the truth. I don't understand, because I think if I were in your place, I'd be complaining about everything. I'd be really angry because I wouldn't accept it. I don't know. I'm talking about accepting it, right? The impression I have is that I wouldn't have the dignity you have to say it. I'm not special, and it happened to me. I would be complaining, I would be pissed off, and I would be cursing up there too. I think so, right? I think so. I hope that maybe if something like that ever happens to me, I grow, right? We can grow, but I have. My initial impression is that I wouldn't accept it. No, it's not that I would go out doing anything, but I would feel really bad.
Me grieving? I was grieving the life I imagined I would have compared to reality. Anyway, what did we imagine when we left, for example, high school? For life? That you, right? Your adult life isn't like what we used to dream about, is it? I think that, we never really managed to achieve exactly what we dreamed of, right? Generally, we imagine great things, right? You graduate, want to go to college, and then pursue your career, and so on. I think I used to imagine life as something that only goes up. So I had to grieve the fact that life isn't just about going up. Life is like
It's
Perdizes, up and down, up and down. So, and after I went through the grieving, then you start looking for other paths, right? To feel fulfilled. I loved working with children, but had to stop. How can I feel professionally fulfilled from home? At least we have technology now, right? I'm not sure.
I've never said, damn, why me?
I never did. I messed things up. This sucks. I can't take it anymore. But I never questioned why it happens to me. Because if I question why it happens to me, I think that's how I see it, questioning why it happens to me. It would put someone else in the line of fire, If it happens to me, I get sad, but if it's someone else, it's fine. I have to take responsibility. Things are with me, on my shoulders.
Zanato, but that's a sign of great spiritual growth. I don't know if I really would. I don't know if I would. I think it's a very impressive thing that you have. It's a lesson. I'm learning here with you. I'm learning to be more humble.
I kept wondering why you invited me, Honestly, I can't see it, And sometimes people tell me,
Why not?
I don't know.
But why did you ask that question?
But I got curious, wow, what could there be in my story, right? For people to invite me, right? To invite me here to your podcast. Of course, I'm very happy. But sometimes I ask myself, because I really think I'm ordinary, not in the bad sense, but ordinary as in common. I think I'm an ordinary person, just like anyone else.
Did it feel like you didn't belong here?
I don't think it made sense, but I kept asking myself. I didn't come to any conclusion.
What was the question you kept asking yourself?
Exactly, wow. But what did that person see in my story, in me, to invite me? To talk with you here today, I took part in another podcast, and she also asked me that, and you still don't have the answer, right? I just hope it was a good conversation and that it makes sense, because if I can't find the meaning, let it at least make sense. For someone who is watching some part of my story, like Anami's story, it makes sense to me.
But isn't it also part of what you've been doing? Talking to show some important things to other people?
Yes, but I think I focus too much on what I'm producing and not enough on myself. I think it has to do with the information I'm sharing and not with my life itself.
With so much detachment, with so much simplicity, I even think that maybe my next question won't resonate with you. But I was going to ask. I kept thinking, Anami, when she died, before she died, she danced, she left a very beautiful video. What would you like to leave behind on that day, which I hope is far away, but that day that comes for everyone, what would you like to leave behind?
I would really like to, but that's more of a personal accomplishment for me, and again, I hope that's how it is. Just like Anami's books moved me, I would really like to write as well, and I would really like what I write, what I say, to have an impact. I don't focus much on inspiration, but I want it to make sense. And Anami's books, that whole thing about movement, it comes back like this. Anami's books moved me, made me look at many things, And I would like to write thinking that whoever reads it, that my writing could resonate in someone else's life like that.
But you were mistreated in some way, violated, right? By a boyfriend who specifically oppressed you when it came to your writing.
That was one of the main things. It really was. One time, one of my advisors praised the text I had written, and he had, I don't know, maybe changed a sentence. And then I got all happy, right? Oh, she said it. She praised what I wrote, and he was like, oh, but I also did this, that, or the other. So that's still a gap. So when a woman or a person who is in an abusive relationship, as I said, she is emptied out, it takes a long time to rebuild. I was in that relationship for 5 years.
Is that why you haven't written your book?
I think that's one of the reasons. That is definitely one of the issues. I mean, it's a lot of work for us to rebuild ourselves.
Facing this trauma is
It's a lot, but you are...
facing something that is much more work. You deal with hospitals, treatments, writing a book.
No, but you know this part of the story? I've already said that the worst pain I've ever felt doesn't compare to the pain I felt being in that relationship. So that's really how it is. It takes a lot of energy for us to recover. It's really a trauma, right? And it's possible for us to recover. We do recover. I'm here, whole. I'm much better, much happier, even sick like this, sometimes in the hospital, than I was at those times when I... Recently, I posted an old photo of myself and my eyes look empty.
You're much happier now than what?
Than I was back then when I was in that abusive relationship. If you look at a picture of me from that time, what you see now, that I'm cheerful, my eyes were empty, lost. So I think it's not just about writing, it's about us. You've written many books, you know that writing really looks at you, right?
A lot.
So I think it's not just about writing. Looking back at so many things I've already lived through, and sometimes even painful moments of the illness. Reliving that isn't easy either.
If you allow me, it's time for you to start. Thank you. You already have a title. You made it up right in the kitchen movement. Really?
I hope so. After I wrote that preface, I think that sparked something more in me, and I had never had any contact with it before. People were praising me, saying, oh, you're the one who wrote the preface. Wow, that's so cool. It's really beautiful. So that puts writing in a different place for me. That it's possible that people might like what I write.
I'm sure that people will like it. There's one thing that every writer who keeps writing and moves forward learns. You can't criticize your own text while it's being written. First you write, then review it to see how it is. Over time, you revise and keep working on it, so you can't keep criticizing yourself because you're probably bringing that criticism from the past. Yes, from that abusive person, right? It's that person who's constantly criticizing you. If I can say one thing, write your book, share your story, thank you, or express yourself. Yes!
I hope that soon I'll be able to face the blank page, the blank screen, and put my story on paper. This legacy.
Given all you've done, you'll make it. Thank you, okay? Thank you, Luis. Thank you, Bruna, for coming. Thank you for sharing your story. And I'm sure it inspires and teaches a lot. It taught me a lot. I learned a lot from you.
I'm really happy to be here today. Thank you.
I'm learning bit by bit. I'm giving you a token of appreciation. Thank you. Give it back to me once more, okay? Hope you like it. We'll talk later.
The editing is up to you, Luis.
What I think is right.
It's right.